welcome to Something to Talk About. I'm Linda McNamee, and this evening we will be talking about Masshealth and Medicaid, and two very hot topics in the news today, so hopefully you will give us a call. You can call in live this evening at 781-270-9199, or you can email me anytime at talk@bcattv.org if you have a question that you think of after the fact when we're not live. Or if you have a suggestion for an upcoming topic that you'd like me to consider, feel free to, just drop me a note, or just drop me a note to say hi. Now, I would like to thank my crew, or not my crew, I always call them my crew, thank the crew. We have Corey McNeil and Mike Duvall, who are staff members here at BCAT, who pretty much keep the place running, especially during the evenings. And also Colleen Moore, who is a volunteer here, and she gives up her Wednesday evenings to come give me a hand, and I really appreciate that. So thank you, Corey, thank you, Mike, and thank you, Colleen. And one last thank you to my husband, Paul, who's home right now with Daddy Date Night with Gwyneth and Evan. So Gwyneth and Evan, I hope you're having fun at Daddy Date Night. And please listen to Daddy and don't give him a hard time. And I will see you in the morning. And now I would like to introduce my guest, I knew I'd screwed up. Sharna Favuzza.
Favuzza, yes.
And thank you very much for joining me.
Thank you for having me. Glad to be
And we will be talking pretty much about just scratching the surface, kind of like the 30,000-foot view of Masshealth and Medicaid, because it is a pretty huge topic from how you sound. Okay.
Yeah, and we'll get into the Masshealth program for people of 65 and older and disabled. So that's really sort of the meat of tonight's topic, but we can start by sort of giving an overview of sort of where everything falls, because there's so many different names for it.
It is a little overwhelming. I remember a few years ago when they were talking about like my parents were retiring, and there were all these questions about Schedule D and the whole prescription drug thing. Everybody was like totally freaking out.
Yeah, there's a lot of different programs, and it's hard to navigate.
So let's back up a little bit.
Hopefully get some clarity on that tonight.
I hope so. Still a few more years before I'm 65 to have to worry about it. So can we start out by having you talk a little bit about your background, where you grew up, why you decided to go to law school, where you went to law school, if you want to say that.
Yeah, sure.
And then how you decided to focus on this particular aspect of the legal system.
Sure. So I grew up in Woburn. I lived in Burlington when I was in high school. So my family moved to Burlington around the time I was in high school.
Okay.
I sort of wanted to be an attorney, back even when I was little, for no reason I could really put my, head around now. But I went to college. I went to St. Anselm's up in Manchester, New Hampshire.
Oh, really? Farmer Dave went to St. Anselm's.
Who's Farmer Dave?
Farmer Dave was a previous guest on my show.
Okay.
He does CSA. So anyway,
well, I'm sure he's great. It's a great school.
He was a philosophy major. So.
Oh, okay.
Anyway. Okay, St. A's.
So after school, it was sort of like, okay, I'm kind of done with school a little bit. Want to get out in the real world. And of course, once you go into the real world, then you're thinking, oh, I want to be back at school. So I graduated with a liberal arts degree, went to work for a big healthcare company in human resources, and built my career there. So that was sort of career number one, was HR, which I loved, but sort of got that itch around 3 to 4 years. There's something else that I want. I want to go back to school, get a graduate degree. What should it be?
Oh, okay.
And I just decided to go to law school for a lot of reasons. For me, I really have a curiosity for learning. So it was, let me go back to school so I can continue to learn. And then the different clients that I can help, I can learn different things in terms of, there's so many different types of practices out there that you can do. So I went in sort of with a global view of what I was going to do. Went to law school, still worked in HR, and then halfway through, left. I went to law school at New England School of Law down in Boston. I think they call it New England Law now.
Oh, okay.
And I worked full-time and I went nights. So I did that for 4 years. So halfway through, I worked for a law firm. And basically, I just sort of learned what they did, which was, basic real estate planning. And they did do some Medicaid planning and some advanced planning.
Oh, okay.
And I just sort of learned as I went. But the thing that really got me interested in what I'm doing now is, I got a call from my grandmother. This was probably, 5 or 6 years ago. And she was frantic. She got a letter from Masshealth that basically denied her benefits. And I didn't know what she was talking about over the phone, but, it was just something that pretty much set her into a tailspin.
Well, yeah.
So, I thought, okay, let me look into this. And that's really what got me onto this, because I never want people to feel the way that she felt. And they're, sort of easy fixes, in some senses.
If you know what you're doing.
Yeah, I don't want to trivialize it. But basically what happened was she was receiving Masshealth insurance benefits, and we'll get into a little bit of that tonight in terms of what that means.
Okay.
But you can only have so many assets. And she said, I don't understand what this letter says, because I don't have any assets. I don't have anything. I don't have anything in my bank account. Well, what happened was she had a life insurance policy. And the life insurance policy was really only about $8,000 or $9,000. So it was a really small policy. But it had a cash value, which means you can basically call the life insurance company and say, I want to cash out my plan, send me the $1,500. Okay. So what happened was her cash value went up right over the limit of what the eligibility is for Masshealth, and so they denied her benefits. So that's what happens. They do reviews of things. They just send out letters to people that say your benefits are denied. So that can be a really scary thing. Wow. So I thought, all right, this is a great area to get into in terms of learning the laws around it, navigating it, and just kind of helping people do the application appeals and all that. So that's really kind of what got me interested in it. And then, of course, the other piece of it is estate planning, and they kind of go hand in hand.
Yeah, they do.
And so as I continued my practice, I got more into that, and now I'm part of the National Academy for Elder Attorneys. And so that's just a networking group. We meet, once a month. It's a national group, and there's a Massachusetts-based group, and it's sort of exchanging ideas and sort of making sure we're all sort of on topic about what's going on, issues with elders. So that's really what brought me to here.
On a personal note, did your grandmother get her benefits reinstated?
She did, yeah. And I'll talk a little bit about that. But yeah, she did, and on some of the ways that.
But wait, there's more.
Things that you can do to get the benefits reinstated. Yeah.
So, I think you kind of already talked about why you decided to go into Masshealth. But what exactly is Masshealth?
So, if we want to start bigger on a bigger umbrella, Medicaid is another word that people use interchangeably. Medicaid, Masshealth.
They are interchangeable.
So people use them interchangeably, but basically Medicaid is the federal program. So part of the Social Security Act back in the 60s implemented the Medicaid program, which basically gives health insurance to low income, the elderly, and people with disabilities. And then Massachusetts has its own branch of the Medicaid office, and so it's a federally run program. Massachusetts does its piece, and it gets federal funds for the program. So long as they follow the regulations, which is one of the layers that makes it a little complicated. Masshealth is the actual name of the insurance that you get if you are eligible for it. So Masshealth is just the actual insurance piece of it. And there's two types
of the Medicaid program.
So Medicaid's really like the program, like the Social Security program, the Medicaid program. And the Masshealth is the insurance piece. And there's two pieces. So there's the Masshealth for individuals with dependent children. So that's a separate program, and the eligibility is
under
different.
18?
Yeah, for minor kids. So if you have minor children, then that's a different type of program. And the program we're really going to focus on tonight is the second piece of it, which is the insurance for people who are over 65 and people who are disabled. And that Masshealth is insurance, just basic insurance. And then there's a long-term care plan, which is for nursing home coverage, which we'll talk about that as well.
Nursing home, does it also include like assisted living or?
Certain programs, not necessarily assisted living in the, like the over 55 communities or some of those communities. It doesn't include that, but it does include long-term care facilities, the nursing homes, rehabilitation, short-term care, personal care assistance. I mean, although they're doing away with that, but that's another thing that you can apply for, to have personal care assistance come, into your home. It's proving to be more expensive to do it that way, so a lot of the times they're more likely to approve you to be in a nursing home rather than stay at home. So that's the sort of that other umbrella piece of it. And then the other one is the Medicare.
Yeah, I was just about to ask you, because I'm like, Medicare, Medicaid.
Yeah, so what's the difference? So Medicare is a health insurance program, and it's a basic program, but that's only for people who receive Social Security and Social Security disability. So if you're on SSI or SSDI because you're disabled, you automatically get Medicare. It's nothing that you have to apply for. But a lot of people have dual coverage. So you have Masshealth and Medicare, because Medicare is
Medicare is not, like Masshealth is the insurance company under Medicaid.
Yes. And Medicare is also under Medicaid. But it's a different program. So the only people that are eligible for Medicare are people who
I feel like I need a flow chart.
Yeah, I know. I probably should have brought a board, and it would have helped. But people who receive people who receive Medicare, it's because they receive Social Security or Social Security disability. So it's an automatic program. But, you know, and there's a part, like you mentioned, Part D. So there's Part A, which is hospital visits, Part B, which is doctor's visits, and there's a C and a D, which is the prescription program. Okay. So there's different programs. Some people have Medicare A and B, or just D, or, you know, that part gets confusing.
Okay.
But a lot of people either have the Medicare plus other supplemental health insurance, like a private insurer, like a Tufts or a Blue Cross. Or if they're eligible based on the Masshealth rules, they have Masshealth and Medicare. So it's sort of two totally separate programs, but they do overlap because Medicare is very basic.
I think I'm following you.
Yes.
This is cool.
So no application for Medicare. If you're on Social Security or you're receiving disability benefits, you automatically get the Medicare benefits.
Now, talking to you now, the term disability has come up. Does that mean someone who has always had a disability, like someone with MS, or does it mean somebody who hurt their back?
No, somebody who has a qualified disability under the ADA, under the disability guidelines, so that they're, you know, permanently disabled, cannot, you know, it's usually if they can't work, because that means they can't get benefits through an employer. And they, you know, usually have a low, if they have a low income. If they have a low income, then they'll qualify for the disability. And that and the reason it's different is because the program is different for people over 65 and people who are disabled versus the Masshealth program for families with dependent children that can't afford private health insurance.
All right.
So.
Wow.
Yeah, it gets confusing.
I do need a lawyer for this.
Yeah. So I mean, we can kind of move in to kind of make it. You know, to that piece of the program for the 65 and older and for the disability. Okay.
Now, I did have a question about, you know, related to the disability, if they had pre-existing conditions before they qualified for.
Yeah, so pre-existing conditions in Massachusetts, the Healthcare Reform Act in Massachusetts was passed in 2006, and that sort of eliminated pre-existing condition qualifications. So health insurance companies cannot deny you for pre-existing condition, and they cannot charge you more money if you have a pre-existing condition. So in Massachusetts, that's been in effect since 2006.
Oh, okay.
The Obamacare, Affordable Care Act, is putting that into effect for the country. So on a lot of levels, I mean, if to give people sort of picture of where we're at, the Obamacare or the Affordable Care Act, however you want to call it, Massachusetts sort of already mirrors that, so we're not going to see a lot of differences in Massachusetts because in 2006, the Healthcare Reform Act changed a lot of how healthcare is handled. So most people probably know that they, you know, as of 6 years ago, they had to have health insurance.
I was just about to ask,
you have to have a minimum coverage, and there's a penalty if you don't have it.
Right.
So what would happen is, you know, when you go to file your tax return, that's where they sort of, it's a catch-all. You have to have proof of coverage or you have to pay a certain penalty.
Okay.
And that's, Massachusetts instituted that already. And that's really what the federal program's about, the Obamacare. That's a piece of it. That's what they're trying to do.
Right.
So when that was instituted, then we got Mass Commonwealth Care. So that's another name that's probably bounced around.
Now, what's that?
So Commonwealth Care is actually going to be obsolete as of when Obamacare comes in.
Which is 2014.
Right. So, but for now, what Commonwealth Care is, it's a subsidy program. So you can go in and purchase private health insurance and it's for people of low and moderate income, but it's for individuals, students, you know, people who are not under the poverty level to qualify for Masshealth, but don't have employers or can't afford the insurance through the employers.
It's like the new college graduate who gets the minimum paying job.
They can go on to Commonwealth Care and they can get health insurance through them. Okay,
now I've heard of people like becoming unemployed and losing their health care coverage and they go on to COBRA.
Yes.
Is COBRA
So COBRA is another federal program.
Okay, yeah, COBRA it's like outrageously expensive. And I'm like, if you lost your job, how can you pay $2,000 a month in health care coverage?
It's a catch-22, yeah. COBRA is still, it's continuous coverage, but it's at a premium. So you're paying 100% of the premium, what you were paying when you were employed, plus the portion your employer paid, plus an administrative fee. on top of that. So
But
that's the total program.
And that would still continue even with Commonwealth care?
Parts of it, yeah. I mean, I don't want to get into a lot of the complexities of the Obamacare.
See, that's why I have my notes here, so we don't go on tangents every
that'll
time.
still happen because that person will still have coverage. But they may not need to do COBRA, which is what sort of happened when Commonwealth Care came in Massachusetts, is because there are other options now, whereas before there weren't other options to get private coverage for less than what the COBRA rates were. So there's more options out there in terms of private care.
Phew.
Yeah.
Yeah, because that COBRA, I'm like, that's so not fair.
Yeah, it's really expensive.
Okay.
So.
How would someone apply for like Masshealth?
For Masshealth. So there's an application, and so now I think if we move the conversation more on, let's talk about the Masshealth. So for the viewers to sort of know where we're at, we'll talk about the Masshealth program that is for individuals who are 65 and older, or have disabilities.
Or disabilities of any age.
Of any age.
Okay.
Of any age. So there's an application. So you go through. There's Masshealth offices around the state. So for the Burlington area, it's the Tewksbury office. There's an office up in Tewksbury that handles it. Okay. And there's an application that you fill out. It's a very comprehensive application. It's about 15 pages, and there's a litany of documents and things that you need to apply. Mm-hmm. So that's really where it gets important to know, am I eligible? Especially, are you 65? Have you turned 65 and you're applying just for the insurance? Or is there nursing home, long-term care imminent for you or your spouse, and you need that piece of it? So we can sort of talk about both.
Sometimes you don't know if the nursing home
that's sort of as you need it. So you apply for the regular Masshealth program, and then if you need the long-term care piece, that's another part of the application.
Okay.
Yeah. So if you're already on Masshealth. So you can
reapply like in 5 years or 10 years or.
Exactly. Yeah.
Okay. So you're not completely locked.
Yeah, no, but you always have to meet the eligibility. So in order to apply, in order to be eligible for Masshealth, you have to have a certain income, and your assets have to be a certain amount. So for the income piece of it, for just the insurance plan, not the long-term care, which is the nursing home piece of it.
Okay.
And the other thing, too, is long-term care, not to be confused with long-term care insurance, which is a private insurance that you can buy. Okay. So you could go to any insurance company, a New York Life or any of that, and buy long-term care insurance. Okay. That's a private pay insurance that you buy in case you need a nursing home, and then it gives you a certain, per diem. Okay. But there is a long-term care program under Masshealth as well, and that's really just the subsidized insurance, for the nursing home piece.
Okay. Now, if this application is really 15 pages and you need to determine assets and everything, should someone go to you right away and say, help me fill this out?
There's so many things that come into play. I mean, the navigation of, so you've got federal regulations on the Medicaid side, and then you've got the Masshealth, the Mass regulations. And so you want to make sure that sort of everything is being met. Okay. And it's important that you do a lot of this thinking about it before you send that application in, because there's what's called the look back period. So if I can back up a little bit, so the income level.
Yeah, I know I'm not following the script. That's sorry.
Okay. Yeah. So the income level is the federal poverty guidelines. So for a person over 65 or a single person, they cannot make more than, it's around $1,000 a month. It's a little less than that, but it's about $1,000 a month. Okay. For a married couple, they cannot have more income than $1,300 a month, and the income is usually some type of pension or some type of benefit that they get.
Now, does that also count like Social Security benefits as part of the $1,300?
There's certain some of the benefits count, and some of them don't, depending on what kind of benefits that they're receiving. Okay. So in general, to sort of kind of keep it.
Okay, I'm sorry, I haven't thought about retirement yet, so it's like,
some of them are. Yeah, some of them are counted and some of them aren't.
Okay.
So that's the income level, and then the asset level is $2,000 for a single person and $3,000 for a married couple. And now countable assets is a different list of things than for some other benefit programs that are out there. So for Masshealth purposes, your countable assets would be any money you have in any bank accounts. Okay. Any qualified accounts, any retirement accounts, IRA accounts.
What if you own a house?
Any of that. Equity in your home can be countable, but only if it's over $730,000. think it's 58 or 80, 785,000. So a lot of people don't meet that piece of it because they don't have that much equity in their home. But if you did have more than 758,000, I think it's 758,000 equity, then that would be countable.
Oh, okay.
So
well, I'm glad that there's
home,
that 700,000 because I'm thinking $2,000. If I own a house, it's there. It's worth more.
No, that's not. The house would not be countable. That doesn't mean that they can't lien the house afterwards, either after the person passes or once they leave the nursing home. But I'll touch upon that later as well.
We'll talk about that later.
So that's where you're at in terms of, am I even eligible for Masshealth? You have to be at that. And the other important piece that I was talking about earlier with my grandmother is the life insurance. So they look at cash values of life insurance too, and that puts people over a lot because the cash value cannot be more than $1,500. And the reason is because they're saying we're not going to pay for your benefits until you absolutely have no money that you can give us. I mean, you can't, unless you sell the house, you can't take anything out of the house to give to them. But they're saying, okay, well, if your life insurance is over, the cash value is over $1,500, then you can surrender it and give us the $1,500. So that's kind of
defeats the purpose of having a life insurance policy, though.
But they're saying we're going to make sure that you're spent down before we give you the benefits.
Oh,
that's sort of what the eligibility is. But so that's what is important too, because you have to look at what assets do we have, because people think, well, either I don't own a home or I do own a home, but it's mortgaged to the hilt. I don't have any retirement accounts. I don't have anything, so I'll be eligible. I'm going to apply now. They apply, they get denied because they go back through all of your financials. So when you send in the application, you have to send in bank statements, life insurance policies, your statements for all of your pension accounts and all those things. And then once they go through that, they may come back and ask you. So I have clients who I represent, and it's a lot of paperwork. So they'll process the application, they call and they say, okay, we want 30 days more of bank statements. We want to go back. They'll send me back bank statements with things highlighted. They'll say, what was this, there was all these expenses in the past 6 months, $3,000, $2,000, whatever it is. And the reason that they do that is because there's what's called a 5-year look back period.
Okay, 5 years.
5 years. Okay. So from the date when you apply for the program, they look back 5 years to see what your countable assets are. Because if you gave away your house to your kids, or you gifted all this money away so that you would be to make yourself eligible for the program, they're going to say no, that's not going to fly. So that money's going to be countable. Now, what do you do in that situation? You try to cure it, which means you either take the house back from your kids or you take the gifts back. If you can't do that because
they've spent it,
you can't do that, then you have to pay a penalty, and basically Masshealth will penalize you, and there'll be a certain amount you have to meet before you're eligible based on that amount of money that you gave away. Which is why it's so important that you speak with someone, estate planning attorney or an attorney who's knowledgeable with the Masshealth rules, because most people, and this is what I come across so often, is they'll say, well, I don't need to do any of this. I'm just going to give my house to my kids. Or people come to me and they've already done that. They grant the house to the kids for $1 or $10 or whatever. And really, they're still living there. They have the right to do that. But there's for other purposes, not just the Masshealth eligibility, that's never a good idea in terms of estate tax purposes. So it's always good to consult an attorney before you make any kind of financial decisions like that. So they look back at the 5 years as to, how have you spent down your assets, and did you do anything to sort of gift away your assets so that you'd be eligible for this program? And if you did, then they're going to deny you that benefit. So it's really important sort of at all those stages to talk to somebody about it, because you really don't know sort of what they're going to be looking for. And the timing is really important because it only goes back retroactively 3 months. So for insurance purposes,
what goes back for 3 months?
The approval. It'll go retroactive, but it'll only go back 3 months. So you want to make sure that you're ready to apply. So I have clients that come to me sometimes. I go through their assets, and that's part of what I do is I'll look through not only their current assets, but a picture of what they've been doing for the past couple of years, so that I know, I may advise them not to apply yet. Let's get to that point where we pass that look back, and then we'll apply. Because we don't want to hit that penalty. We want to just make sure that at the time you're eligible, you'll start to receive the benefit. And that, and it depends for every situation. Now, when you're talking about long-term care, that's a really hot topic right now in terms of nursing home protection.
Okay.
That's where there's two types of planning that I do for clients. I do advanced planning, and then I do a lot of crisis planning. I've been doing a lot of that work lately. And what that is, sometimes for the advanced planning, a couple sits down, they're, in their late 60s, early 70s, relatively good health, but they want to plan for needing a nursing home someday.
Okay.
Now, we're not talking about clients that sit down that have millions and millions, because you can't protect or hide all that money from the government to get, and those people aren't looking to get mass health benefits. But people who have worked their life, they've saved, and they have a home. It's usually a family home that they want to protect. And they want to be able to pass that on to their kids. So you can do certain trusts and things to help do that. But that's more of an advanced, you need to do it within that before that 5-year period because of the look back.
Okay.
Excuse me for 1 second.
No, I'm glad. It's like, okay, cool.
Yeah, so that's the advanced piece of it.
Okay.
But a lot of what I do is crisis planning. And that's when I get somebody that comes to me that's either, their family comes to me because they need a nursing home. They're actually looking for one that week, or they just went into a nursing home. Or the spouse calls me, and there's what's called a community spouse allowance. Okay. So that planning's a lot different. So the application is pretty much the same. The asset levels and the income levels are the same as what we talked about. You can't have more than $2,000 for an individual, $3,000 for a couple, and then the income is the same, $1,000 and $1,300.
Okay.
But the look back applies. So what's important at that stage is to make sure, especially if there's a spouse, that's really where I can really help somebody in terms of getting them to. There's a balance. You want to get the person eligible for the nursing home, for the mass health, the long-term care benefits, ASAP. At the same time, balancing the community spouse, the one that's still going to live at home, you want to keep them financially secure.
Okay. Keep them in the house.
Right, and you want to do that, and they can always stay in the house, so that's one of the rules. But but you want to make sure that you're following the rules to do that, because the regulations are not clear. And they're not going to, the people at the Mass Health office are not there to advise you on how to spend down your assets to meet the rules. So, it can get it can get pretty confusing. And so what you don't want to do is you don't want to go forward, start paying a nursing home, and then inadvertently spend down assets on a nursing home that you could have protected under the community spouse allowance.
Oh, okay.
So the regulations allow you, let's say you have a couple that's over 65.
Okay.
One of them goes into a nursing home.
Okay.
The community spouse is allowed to keep. It goes up with inflation, but for 2013, it's around $115,000 that they can keep for themselves, because the regulations took into account that they don't want to impoverish the community spouse that's living at home. Okay. So they can always stay in the home. The home is always protected. Now, at the end of the day, could Medicaid put a lien on the house? Maybe. There's some situations where they could do that. Okay. But there's also post-planning and things that you can do after they become eligible for benefits, allowed under the rules, to help prevent a lien. So that's another place where it can get complicated. But so the community spouse is allowed to keep $115,000 in assets, so that's liquid assets if they have money in the bank, pension accounts, and anything like that.
And they'd still qualify for Medicaid?
Yes. The spouse that needs to go into the nursing home. So long as their monthly income is below what a nursing home costs. Okay. And that's usually the case, because most nursing homes
are expensive, I've heard.
Yeah, they can, $10,000 is probably a low number. I have clients that are, go from anywhere from 8 to, way beyond that.
Wow.
So, and there's only certain nursing homes that take mass health. So you have to kind of do that research as well. Okay. So that's a really critical time. And so that's really, one of the things that I really like about what I do in this piece of it, because when people come to me in that crisis mode, it's a really confusing time. It's a really emotional time. And the financial piece and the paperwork cannot be overlooked. And so they really need someone to help them do that. Okay. And so I'm really able to
They're probably not also thinking clearly with all the legalese. It probably gets
it's a lot. So
overwhelming.
I can really take that burden off of most of my clients and really kind of walk them through that process. So for the community spouse, and this is really important, is they not only can keep $115,000, but there's allowable expenditures that they can spend their money on, in even while they're applying for nursing home care for their spouse. maintenance and things that need to be done to the house.
Okay.
So I had a client recently who, similar situation, in their 80s, husband went to a nursing home. I mean, the house was in disrepair. They needed a new septic system. There was issues with that. There was issues with, because the husband had done some electric work or whatever in the basement. There were wires exposed and just things that needed to be done.
Right. Get everything up to code.
New windows. Yeah, she was driving a car that was 15 years old, and now she had to drive an hour every day to the nursing home, and it wasn't dependable. So, she can buy a new car. I mean, she can't go out and buy a Bentley, right? But she can buy a reasonable car. I mean, they're going to look at a reasonable amount. She can have her septic system fixed. She can get a new stove if that's broken. I mean, so as long as things are reasonable, and you're not looking like you're just spending the money to avoid, having to pay to the nursing home and to make yourself eligible. If it's really
if you need the new appliances, you probably don't want to go with the stainless steel 6-burner
stove.
stove.
Viking stove or any, right. You probably want to stick
double
to the
ovens.
Kenmores and that, right. But there are things that you can do, but people don't know that. They don't know, so they think that they're in a crisis, and they're going through that emotional piece of having their spouse go into a nursing home.
Right.
And they don't know that they're allowed to do all these things. So you go to a nursing home and they say, okay, it's $13,000 a month. You have to write us a check, and they have $100,000 in the bank, so they just keep writing checks. But at that point, it's too late to get that money back.
Yeah.
You know what I mean? So that's why what's really important, and if your viewers take anything away from this conversation, it's get in touch with an attorney who deals with Masshealth and Medicaid applications, and do it as soon as you know somebody needs a nursing home, or even before that if you want to talk about advanced planning. But really, as soon as you think that you or your spouse or a loved one is going to need a nursing home, that's really when you want to get in touch with an attorney, because you want to kind of look at all these things to make sure you're not missing anything. And the financial stability of people of that, in that part of their lives is really important. I mean, there's not a lot of income coming in, so it's not like they can make it up, and they're really, trying to just live within a budget. So it's important to be able to be eligible and also play by the rules.
Now, we had mentioned, if I heard you correctly, someone's about to go into a nursing home and they already qualify for Masshealth?
Yep.
To contact an attorney. What if they don't currently qualify for Masshealth? Should they still suggested to contact an attorney so they don't end up needing Masshealth?
Yes, because you don't want to get to a point where it's maybe 2 or 3 years down the road, and now you're going to apply. In general.
Right,
and now you're going to apply for Masshealth, but you've made expenditures and things that now are going to disqualify you for.
Right.
Disqualify you. Or there's planning that you can do ahead of time to kind of conserve as much as you want. And and it's not about sort of defrauding the government or hiding your money. I mean, there's ways to do it that when you play by the rules, that the rules allow for this type of planning, which is why you can do irrevocable trusts, and there's, before 5 years, because it's only that 5-year look back.
Okay.
Now, could the laws change? Yeah, they could change. I mean, it could be a 3-year look back. It could be,
Right.
But for right now, that's what it is. But it is a moving target with the regulations. And the thing that's difficult about the Masshealth and the Medicaid, which is why a lot of people hire attorneys to do it, is that it is so much of a moving target, because the Medicaid office makes their own decisions and they interpret their own regulations. Whereas a lot of other administrative agencies don't do that. They have checks and balances. They do what's called comments and hearings, which means you can kind of flesh out the regulations before they're put into effect. The Medicaid and Masshealth don't have that. So they're sort of interpreting their own stuff. Sort of like where the rooster is running the hen house or something like that. And so it's just really hard to kind of get through those regulations, and you're not going to get that level of service at the Medicaid office. You're just not going to get that kind of help.
Because it's a government agency. It's like the DMV. No.
Yeah, I mean, they're really good. I mean, especially the centers that do the long-term care. I mean, they are really good, but they're not there to advise you on how to spend down your money or handle, what I mean? They're really to help you through the application process.
Okay.
So.
I had another fleeting thought, and it just left. Oh, you were talking about, it is a moving target. Not to totally screw up the plan, but with Obamacare or the Affordable Care Act kind of being right around the corner, do you see that as a huge change in how you do your job or Medicaid currently runs, because we are in Massachusetts, and Massachusetts is a model?
Yeah, no, I mean, for the most part, we're already sort of doing all the things that that Obamacare is going to implement. The only difference for Mass really is more people will be covered, so it's really going to expand the gamut of people that will get the subsidized insurance.
Okay.
And Mass will get more federal monies for it.
Okay.
That's really what. But in terms of the Medicaid regulations, the application process, everything that, you know, there's no changes that I know of for that. I mean, the application process is going to be the same. The eligibility rules in terms of the income, the assets, that'll all stay.
Okay, so
stay the same.
If there are changes, they won't be significant.
No, not in Massachusetts. I mean, we're already used to sort of what's going on, and it's not really going to affect that population because they're already receiving that kind of care.
Okay.
It really just opens it up for the, you know, people who are under 65.
Okay.
You know, to get more people eligible for, you know, subsidized health insurance.
Okay. Wow, I think my head's about to explode.
Yeah, I know. You try to keep it, you know, I wanted to make sure that people got something out of it.
No, it's really good.
But,
it's just,
you know, keywords, you know, what I tell a lot of people is, you know, nursing home, sort of protecting the family home, you know, mom's, you know, getting sick or kind of, you know, not doing very well and we're not sure if she can stay home, or dad's, you know, not feeling well. I mean, those are triggers for a family to say, okay, maybe we should sit down and talk to somebody.
Okay. Now, along with the nursing home line and planning for long-term care, long-term or nursing home care there's a broad spectrum there. I mean, if someone has terminal cancer and they go into a nursing home, versus someone who has Alzheimer's, or someone who is just in need because they're 90-something years old, but other than that, no major health concerns. They might be there for, you know, 30 years as opposed to 5. So does that impact any of the planning for the reason why the person's going to the nursing home? Does that make sense?
In terms of, you mean eligibility?
Eligibility or planning or,
eligibility. For eligibility,
and
no, it'll always be the same. You know, for eligibility, it'll be that point in time. And you have to continue to be eligible. So, I mean, that's, you know, like I talked about my grandmother getting that letter. I mean, that's what happens is you have to continue to be eligible. So if you get an inheritance or, you know, your investments, you know, well, you probably don't, at that point, you don't have investments. Or if your life insurance policy goes up, the cash value goes up, you become ineligible, you need to spend down assets to requalify. So it's always eligibility at that point in time, not just when you apply and then they forget about you. You have to continue to be eligible year after year. So it doesn't really matter how long you're going to be there as long as each year you continue to be eligible.
Because I'm thinking, I think for the community spouse, I'm thinking once that person in the nursing home passes away, they no longer have that expense of the nursing home care. So how popular would it be for the community spouse to no longer need Medicaid? Would that happen where it's just,
you mean if the community spouse is on Mass Health in terms of they're receiving the subsidy insurance?
Or if they're spouses. I think I'm kind of confused with like the cost of nursing home care.
Yes.
And needing Mass Health. You know, so if I were in a nursing home and my husband were at home, we as a couple would qualify for Mass Health because of the nursing home expense. And then when that expense is no longer there,
so it's not really based on the nursing home expense. I mean, because, you know, in a way, yes, the eligibility of the long-term nursing home care is that your income has to be less than what the nursing home cost.
Okay, so it's still income-based.
So it's still income-based and it's asset-based. But so if the institutionalized spouse were to pass, then unless the community spouse needed Mass Health, the regular insurance, you know, then that's a different ballgame. You know, then are they going to be eligible for the Mass Health regular insurance? No, because if they've been able to have $115,000 of dollars in assets, probably not. So that's probably not going to be the right program for them. But there's certain planning and things that you can do to avoid it. You know.
Yeah, I think that's where I'm getting fuzzy. I remember just recently we went through the whole estate plan, and I was just sitting there with the deer in headlights look, and it's very overwhelming. So I'm glad you understand it. Okay.
Well, my job is to make you understand it. So and the viewers, right? So if there's anything, and it gets tricky. I mean, all these,
there will be a quiz on this.
There's always those what ifs, So really, the take home is, if you have any questions, seek some help, or if you're in that planning stage, or maybe your parents or your aunts and uncles, you feel like they're failing or they need help. I mean, that's really it's never too early to start planning.
Okay.
But sometimes it can be too late. That's really the takeaway.
Okay. Moving onward, I don't know if we covered this to a sufficient extent, but one of the questions that I had earlier was, how does Masshealth assist individuals with disabilities?
So that's part of that same program.
Okay.
So there's different applications, and for the subsidized health insurance piece, it's individuals that are 65 or older or disabled.
It's the same.
And so the eligibility, the income and the assets we talked about is the same for disabled.
Okay.
Yeah.
How does it manage prescription drug coverage? Because I do remember, maybe it was back in 2006, it seems a lot more recent than that. I remember my in-laws and my parents totally freaking out about all the different schedules and insurance. So how does...
Yeah, so that's more, the schedules and that is more Medicare, because you've got the Part D, the prescription program. But if you're on Masshealth, then you have a prescription program and a dental, to a certain extent, and vision in place. So Masshealth is really like, if you go, it's like having a Blue Cross Blue Shield or having a Tufts, because it's a separate plan, and it has certain it usually doesn't have deductibles or copays. It's a sliding scale, but but it's really designed like a private insurance in a lot of ways. Only the person who has it, the insured, doesn't pay a lot of the copays and all those things that you would if you had private insurance. The Medicare piece of it is that different piece of it where it's just you have different parts. But when you have Medicare, you probably have a supplemental insurance like a Tufts. Or if you qualify for Masshealth, then you also have Masshealth, so it kind of covers. It's called sort of Medex or Medigap insurance. There's different private insurances out there that you can buy that just sort of fill in the gaps of Medicare.
Okay. And I don't know if this is a good question for you or not, but just thinking about the prescription drug coverage, and a lot of times the insurance company, my health insurance company would say, no, you need the generic, or you need, this one isn't covered, and there are different tiers. I know somebody recently who had to go on a prescription drug that was going to cost her $3,000 for a month, and that's with the insurance covering their portion. What happens if somebody's on Masshealth, and do they still have these same limitations or same rules to follow?
For the most part, I mean, you're going to get, generic brands for the most part. I'm not really sure in terms of one of those, drugs that are sort of over the limit.
The outrageously expensive
the outrageously expensive ones. I'm not really sure. I haven't encountered that in terms of having a client say they've, haven't been approved for it. But I don't represent a lot of clients in that piece of it. Like the Masshealth for people with,
Because I think it's after we had kind of gone over the questions that someone approached me and said,
I mean, it's pretty comprehensive. I mean, in terms of the coverage, I mean, it is a basic care. I mean, you're not going to get all the extras that you may get with a private insurance. But it is pretty comprehensive. So if you had Masshealth versus having a Blue Cross Blue Shield, if two families, one had Blue Cross private and one had Masshealth, there's really not going to be a lot of difference, except for the providers. So not all providers take Masshealth. So you have to go to physicians and dentists that take Masshealth. I mean, there's a lot of them out there. You know what I mean? It's not that.
How would you find them? Through Masshealth, through the Masshealth website?
Yeah, you can go on. I think it's Masshealth or massresources.org or Masshealth Connect. I think you have those on your website. You can go on there, or you can go on to the physician website, and it'll tell you what insurances they take. But I would always, always, always call that doctor's office and ask them if they take the insurance before you go, because you never know what's updated on the website. A lot of times the doctor's
offices, when you call,
normally you can't even get in to see them before they get your insurance information. I've never had that happen where I could just go see a doctor and then they say, oh, by the way, what's your insurance? So usually that they already put that check in place. But
what advice do you have for someone who needs health insurance in general?
In general? So it's an interesting time to ask that question because a few weeks ago or a few months ago, I would have said, you go on to the masshealthconnect.com and it gives you all the options based on your income. None of the websites are working right now. And so under the Obamacare, and I don't know, if people watch like the political pundits or whatever they see out there, that nothing is working. So there's all these websites set up for you to go in and sign up for insurance for 2014. But it's like a web nightmare. So from what I'm hearing. So for right now, it's sort of difficult. But I think Mass Health Connect might still be up and running. I'm not positive. But that's where
So are they preparing for the transition? So that's why they're...
I think so. Yeah. And I think it's just the infrastructure. I think it's just the rollout of the Obamacare program. And there's just all these, glitches in the website. So... But I can certainly get you some information to post on your website when I sort of figure out what's going on.
I'm just kind of curious because, I think we've covered a lot of, what we had planned on covering.
Yep.
And we still have about 10 minutes left. So I'm just like, okay, what am I missing? Because is there anything you wanted to add about the Affordable Care Act? Because I think we pretty much covered a lot of that.
Yeah, there's not really, there's a lot of pieces to it. But again, most of us in Massachusetts are sort of like, what's new? There's really not a whole lot of changes in terms of what we're going to see because we're already, required to have health insurance at a minimum coverage. And so there's a lot of plans. When this Healthcare Reform Act went into place in 2006, it put a lot of insurance people sort of out of our market. They sort of said, okay, we can't offer those plans, we can't compete, and it sort of put a certain part of the insurance industry out because it has to have minimum credible coverage. So I had a client call me who he was a truck driver and he worked for a national company, but he lived in Massachusetts. Well, the plans that they offered as an employer didn't meet the Massachusetts minimum coverage standard, so he couldn't take those plans or he'd have to pay the penalty. So he was in a catch-22 where, the private insurance is expensive, and the penalty was going to be expensive, but he could not have insurance because of the laws of Massachusetts. So the Obamacare piece will fix a lot of people that fall through those gaps anyway, in terms of from a Massachusetts standpoint.
And like self-employed people and
it'll offer
small business owners. And, kind of backing up a little bit. Do doctors or hospitals, as seen on TV, a lot of times those who are on Medicaid or Mass Health get treated differently than those who do have private insurance? Or it was more like the uninsured versus the insured, that there's that discrepancy?
I haven't seen that. I don't have an opinion on it. I think it's probably a personal opinion in terms of what people's experience have been. I've never heard any of my clients or anyone that I know complain about the difference. Do you
think it's because that they do have health insurance coverage and they're going to doctors who accept this coverage?
Well, because you're only going to be seen by doctors who unless you're in an emergency situation, but they're going to accept the Mass Health, in terms of emergency, for emergency services. But, and you're not going to get in to see private physicians who don't accept Mass Health. So at that point, whatever their rates are behind the scenes in terms of what they get paid out, they have different, their contracts are different with all private insurances and the Mass Health. So I think in terms of what they get financially, it's the same. And I would like to think that as a health professional, they're, administering the Hippocratic Oath and they're, and they're serving all patients the same, no matter what their insurance is. But that's just the positive side of me. But I haven't heard anyone ever complain that they're getting treated differently.
Are there quotas for doctors' offices accepting new patients where they're allowed X number?
I don't know. That's a good question. I don't know. I think you either take Mass Health or you don't. And you're accepting new patients or you're not. I think it's a different count. You know what I mean? I don't think that they're exclusive.
Just kind of.
I don't think, but I'm not sure.
Well, in your experience,
I haven't heard anyone say they got turned away even though they take Mass Health. If they're not accepting new patients, they're not accepting new patients of any insurance. So.
Now, I know you said that this is another huge topic, but when we first started, with the few minutes remaining, you had mentioned that the Masshealth program is for 65 and older or disabilities.
Yep.
Now, was it also Masshealth that had the people with dependent children?
So that's a separate insurance program.
Okay.
People who are on the transitional assistance, the food stamp program, any of those programs will automatically qualify for Masshealth because the eligibility is the same.
Okay.
But it's a similar program.
So like the amount of assets, the amount of income.
Yeah.
Those breakdowns are the same.
That's similar. Yeah, but the amount of assets is the same, but the income is different. I don't know what it is off the top of my head, but it's based on the federal poverty guidelines.
Okay.
And it's based on age and size of family in terms of what the monthly income will be. So the eligibility is a little bit different, and the program is administered differently.
Okay.
But that program is for families with dependent children.
Okay. Now, if a family is on welfare, they would automatically
qualify.
Now, if they weren't on welfare, would it still be part of the Masshealth?
They may still qualify for Masshealth.
Right.
Not often.
No, I know it's not exclusive.
Yeah.
But, okay.
Yeah, not necessarily. I mean, most likely they will be, but they may not. I mean, they may have an employer who covers their health insurance, but they just don't, their income is low, you know what I mean? So it's not always, I mean, usually they're on both programs because if their income is that low, they probably work for an employer who can't afford to offer the health insurance. Although obviously that's changed as well over the past couple of years. But yeah, for the most part, if you meet the eligibility requirements for Masshealth, you probably need the insurance as well as the transitional assistance.
Got it. Oh, another question just kind of popped into my head that I'm not sure if you answered or not, but backing up from when you were talking about planning on a spouse going into a nursing home.
Yes.
You had mentioned, estate plan also popped into the conversation, those key words. Should someone have an estate plan in place before applying for Masshealth?
Well, you should always have an estate plan in place for a lot of reasons. But you should. So the answer is yes, but you also want to know, and if you're sitting down with the estate planning attorney, you want to also let them know that that's sort of what the plan might be that you think. And usually that's part of what the questionnaire is. What's the health? Do you think that there's, a possibility that one of you may need a nursing home? And, so, because you want to plan for that, because you don't want to plan and have them gift away or put assets in a trust that they can't get back and then find out it hasn't been 5 years and they need to apply. So it's just the timing of everything is critical, and you kind of have to take a global view of people's financial assets, their goals, and sort of like their health. And that's really how you decide as an estate planning attorney what's going to be the best program for them, because you don't want to box them into a corner and them not be eligible, but you also want to protect their assets as much as you can ahead of time.
Okay. So if someone needed an estate plan and they were also concerned about health insurance coverage, is that when they would call you specifically?
Yeah, that's when they were ready to sit down to do an estate plan. Or they may have an estate plan from years ago and you really should have it looked at every 5 to 7 years.
Okay.
Or they're in a different, stage. They had an estate plan done when their kids were young or 5 years ago, and now they're looking at nursing home planning. And so they may need a new type of estate plan. Yeah.
They did it 20, 30 years ago. Okay.
Right. Or, and I've had a client before, an unfortunate situation, and they're young, they're in their 50s, 60s, and one needs a nursing home. And so, you're doing planning early in that sense, in terms of the Medicaid planning.
Okay. Now, what other areas, here's the plug for you.
Okay.
What other areas of law do you focus on? We have the health care coverage.
Yep, the Medicaid planning. That's sort of part of the elder law. So my focus of what I've learned in my career is I do real estate law.
Okay.
I do estate planning. I do advanced estate planning. So I do the Medicaid planning and advanced, trusts with, for tax planning and that sort of thing. And then I do elder law, which really comes into, I really focus on the Medicaid planning, the Masshealth eligibility. I do appeals for people that have been denied, and things like that. And then I also focus, because of my HR background, I focus on employment law. So my firm does a lot of litigation.
Okay.
And so I sort of work with them sometimes on some of the employment litigation. So I
Okay.
represent, mostly companies, small businesses, and help them get compliant with, the different employment laws and that sort of thing.
All right.
So.
Excellent. Well, I think we're just about out of time.
Covered it, yeah.
I think we covered it all. My brain is
It's confusing,
still full.
Yeah, well,
trying to sort it out. I'll probably wake up at 4 o'clock
any
tomorrow
other
morning
questions
going.
you have and you want to post on your website, just shoot me an email and we can get
Okay.
some information up there for your viewers. But
So I think we've had your email posted online
Okay, great.
periodically throughout the show. Or if anybody has forgotten or missed that, they can always email me at talk@bcattv.org, and I can always forward that on to you as well.
Great.
So
Well, thanks for having me. It's
thank
been
you
a
very
pleasure.
much, and good luck in 2014.
You too. Thank
So,
you.
Right. Thank you, everyone, for joining us this evening. I hope you enjoyed our conversation as much as I did, and I hope your brain is a little bit less in pain than mine is. But I've really appreciated Sharna coming on, and I hope you have a pleasant week, pleasant evening, and pleasant fall.